78-year-old female presented to me with left eye field loss and decreased vision as she woke up in the morning. The best corrected visual acuity was 6/36 in the left eye and it was 6/6 in the right eye. Apart from that, anti-segment examination was within normal limits in both the eyes. She was a known hypertensive and she was not on treatment for the same. Fundus examination, the retinal edema was noted superior to the fovea. There was venous tortuosity along with that superficial hemorrhages and disc edema was also noted. We made a diagnosis of central retinal venous occlusion with cilioretinal artery occlusion. As central retinal vein is occluded due to thrombus or embolus, there is sudden stoppage of blood in the central retinal vein, which leads to sudden rise in the pressure in retinal capillary bed. Normally, the perfusion pressure in the retinal arterial vascular bed is higher than in the ciliary arterial vascular blood and consequently in the cilioretinal artery. When there is a sudden stoppage of blood flow by a thrombus in the central retinal vein, the blood pressure in the entire retinal capillary bed transiently rises to the level of central retinal artery blood pressure. Cilioretinal artery is a branch of choroidal circulation. It enters the retina from the temporal optic disc. Its blood pressure is way less than the central retinal artery. The blood pressure in the retinal capillary bed is now also high because of occlusion of central retinal vein. So, blood pumps from higher pressure system to the lower pressure system. As the blood flows from a higher pressure system to a lower pressure system, cilioretinal arteries cannot pump blood into the retinal vascular bed, which creates a physiological block in the circulation and creates a picture of cilioretinal artery occlusion.